Consider what these people have in common. All of them are older adults, and most take multiple drugs for a variety of chronic medical conditions. As a result, they are at increased risk for a number of problems associated with polypharmacy, taking too many medications. These can range from symptoms affecting quality of life, such as dry mouth and upset stomach, to other conditions such as increased falls, declines in cognition and function, and even increased risk of hospitalization and mortality. For these reasons, the VA Connecticut healthcare system and faculty affiliated with the Yale School of Medicine developed Improve, an interprofessional experiential educational program for postgraduate primary care residents to develop their knowledge and skills in addressing polypharmacy in older adults. The Improve program was designed to educate residents in the recognition and management of polypharmacy among older adults and to improve patient outcomes. It seeks to increase collaboration across professions and was first introduced to the interprofessional residents in the VA Center of Excellence in Primary Care Education at the West Haven, Connecticut VA. This program includes internal medicine residents, nurse practitioner residents, pharmacy residents, and health psychology residents. From the outset, the Improve program focused on the pillars of the Center of Excellence, developing interprofessional collaboration, use of shared decision-making, performance improvement, and sustained relationships to transform how primary care is delivered. Residents participating in Improve identify one of their patients who is 65 and older and on 10 or more medications. Residents then follow these key steps. They spend time in individual preparation for clinic, then meet as a team for pre-clinic conference. This is followed by a group visit with patients and caregivers, an individual visit, and team precepting. Let's look at each more closely. During the clinic preparation, residents review their patient's chart, a medication worksheet, and the de-prescribing guide found on the Improve website. The medication review worksheet helps them extract important data from the chart and organizes the patient's medications by indication. The de-prescribing guide gives suggestions for de-prescribing opportunities and provides links to tools and other resources to use. This first step allows residents to reflect on their case and gain knowledge by exposing them to new de-prescribing tools.
So today we're going to be talking about Mr. Jim. He's a patient on my panel.
At the beginning of the pre-clinic conference, residents present their cases to the other residents and faculty, and as a group, they discuss concerns and potential de-prescribing opportunities. Faculty or residents present a focused didactic around safe prescribing in older adults, usually around a particular class of medications, or sometimes a specific condition with unique treatment considerations for older adults. Additional examples can also be found on the website. In this setting, residents continue to think about polypharmacy from different perspectives, learning from the discussion of their patients and their colleagues' patients, and begin to understand and demonstrate that they know how to approach their patient's medication list. The group of residents meet with the patients and their caregivers to learn about the patient's concerns and frustrations with their medications, that is, what matters most to them. The group visit also allows faculty to provide some patient education that is relevant to the group as a whole. A discussion guide for those leading the group visit can also be found on the website. During the individual visit, residents perform a medication reconciliation, orthostatic vital signs, a cognitive screening, and a functional screening. Here they utilize the strategies they learned in their shared decision-making didactics with faculty. Residents are now primed to engage in de-prescribing, showing how they approach polypharmacy with their patient. Last, residents precept with the primary care provider or geriatrician and a team that may be composed of a pharmacist, geriatric pharmacy resident, and health psychology resident. They review and refine a deprescribing plan, taking into account the patient's unique considerations elicited in the group and individual visits. They often work with other providers as well in the coordination of care and recommendations, and utilize the template found on the website for documentation purposes. Evaluation of the program by residents and patients included both quantitative and qualitative methods. 2 groups of internal medicine residents, the Improve residents, and a control group of residents who did not participate, were tested regarding their knowledge of deprescribing. The Improve group score rose from a baseline of 60% to 76% over 6 months. The control group's test performance did not change. A focus group composed of Improve residents revealed that in general, they perceived an improvement in their knowledge and skills and highly valued their interprofessional training experiences. Further, they made systems-level suggestions to improve the program. Last, the educational intervention resulted in a change of the residents' practice, both in the clinic and in the hospital. Also, patients participating in the Improve clinic were more likely than matched controls to have medication stopped or medication doses decreased.
I was taking way too many meds, but the folks at Improve went over everything and helped me understand exactly what I should be taking and why. They went over everything and found a whole bunch of stuff that I just don't need.
I'm not dizzy anymore, and I feel more stable when I walk.
I tried to manage his medications, but I'm new at this. It was very confusing, but the staff helped with everything. They even streamlined everything.
After we made some changes to my medications, I don't feel so cloudy and sleepy. I'm getting out more and walking.
The Improve program was designed to be replicated, and its use is not limited to VA facilities, nor do you need all of the faculty found in the original program. It can be designed with primary care and clinical pharmacy faculty leading the clinic. With a foundation of novel and impactful curricula, the Improve program uses rigorous methods to change resident practice regarding deprescribing medications to older adults. It is a program very much in keeping with the directive given to them at the outset of their professional careers. First, do no harm. If you're interested in implementing an Improve program for your institution, you can learn more at this site.